Hello, everyone. This is Shadresh from CVI 2025. I'm really privileged to be with Dr. Robert Rheeand to talk about a new endovascular device for patients with a thoracic aneurysm, especially in the arch area. Dr. Rheeand, thanks for being with us.
My pleasure.
Yeah. So tell us about this new device, especially when you have arch disease, aneurysm, or dissection.
It can be applied for both, but it's a device that was introduced several years ago by W.L. Gore to treat patients with aneurysms of the arch, as well as dissections, namely type B dissections. And it allows the physician to treat these complex aneurysms of the arch without doing a big open operation or surgical operation.
No. And when you are in the arch, you have a lot of branches,
Yes.
like a nominate, as well as cleavage. So how is this managed with the graft?
The branches are basically categorized into three levels. Zone 0 is the branch in the proximal aorta called the innominate, and that artery, this device can be put into that artery, but you have to do extra anatomic bypasses, or it can be put into the common carotid artery, the left common carotid artery, or the left subclavian artery. So it can be put into any of those branches. It only has a single branch, so that it can be put into one of the branches and then do a bypass from one of the branches that was treated to the other branches that were not treated. So it's a very useful device for treating these arch aneurysms and dissections without opening the chest and doing the traditional surgical operation.
So this is a transfemoral dual axis or one axis?
It's a dual axis. You have to go transfemoral you have to come from either radial or brachial, and then you put a through and through wire to introduce the branch into whatever super aortic branch that you would like to treat.
What is the French size in the radial and the femoral?
The radial is just to introduce the device through the groin, so that you have a through and through wire. So the access is only 4 French.
For French, okay.
Through
And the
radial.
groin axis?
Groin access, depending on the size of the device, can be anywhere from 22 to 24 French. So it's a pretty large device.
Yeah. And usually you do a cut down or you do like a...
It's all percutaneous using the pre-closed ProGlide system from Abbott, and we use 2 of them, and they work great for treating large bore access.
Is there any specific antiplatelet therapy patient should be on post-procedure?
I generally place them on Plavix for 6 months for the branch to make sure that the branch stays open, but nothing long-term is required.
That's great. Okay, again, new option, new technology, where innovations.
Yes, it's new. It's a new option. The first year that it was released, well over 1,000 of these procedures were done, and now it's between 1,500 to 2,000 of these procedures. So this is really good for the patients who have arch aneurysms. They don't have to undergo a very complex and dangerous open surgical operation.
Absolutely. Dr. Ray, thanks again for introducing this new device and innovation at the CVI. Watch these videos and others on the YouTube channel. This is Shadresh coming to you from Austin in 2025.